When assisting a patient using a bedpan, always primarily provide privacy by closing the bedside curtain or the door of the room. Warm a cold bedpan first by running it under warm water for a few seconds. Dry it afterwards and then cover it with a bedpan cover or towel. Make sure that the side rail on the opposite side of the bed is raised before raising the bed to a comfortable working height. If the patient is able to, ask her to raise her hips and help her move into a supine position and raise the head of the bed 30 to 60 degrees. Lower the top linen so it will not obstruct what you are doing, but do not expose the patient more than what's really necessary. Remove the bedpan cover and have it ready nearby. To prevent it from sticking powder the rim of the bedpan, ask the patient to bend her knees and lift her hips. If it's really necessary, help the patient by placing one hand palm up under her sacrum. Slip the bedpan under the patient with your other hand with the rim facing the foot of the bed. When using a fracture pan, slip it under the patient with the narrow end under the sacrum as the hips are raised. For immobile patients or with limited mobility, lower the head of the bed flat if medically appropriate and then raise the bed to a good working height. Roll the patient to the opposite side so that his back is facing you. Place the pan firmly against the buttocks and then push it down towards the mattress. Make sure that the open rim of the bedpan is facing the foot of the bed. Hold the pan in place with one hand centered under the patient and put your other hand around the hips and help the patient roll flat on his back and onto the bedpan. Do not force the bedpan under the patient. If allowable, raise the head of the bed 30 to 60 degrees and then raise the knee gash or help the patient bend her knees. Once the patient is comfortably resting on the bedpan, cover her so that she is warm, using the top linens or a bath blanket. Place the call light and toilet tissue with easy reach and tell her to wipe from front to back to prevent transmission of anal bacteria to the urinary tract. You can now remove your gloves. Make sure that the bed is in the lowest position and that the side rails are raised. At this point, provide privacy, but make sure to monitor the patient and respond immediately to her call light. When she informs you that she is finished, perform hand hygiene and then put on a fresh pair of gloves and then place a chair on the side of the bed that you will work on. Remove the top linens and ask the patient if she has already wiped her perineal area. If she is able to, ask her to flex her knees and lift her buttocks. She can do this by shifting her weight onto her feet and up her torso. You can help the patient by lifting her sacrum with one hand and then holding the side of the bedpan with the other hand. Remove the bedpan and put it on the bedpan cover and place them on the side of the chair. If required, help her to perform hand hygiene. On an immobile patient, lower the head of the bed and hold the bedpan steady and help the patient roll on his side to be off the bedpan. Take the pan away and place it on a towel or bedpan cover and put them on the chair. If the patient is unable to wipe the perineal area, clean this area going from front to back with the use of a toilet tissue or a perineal wipe. Note the skin integrity in the perineal area. If intake or output is being measured, put the tissue in the trash or a biohazard container. If necessary, perform the perineal hygiene. Place the cover on the bedpan as soon as possible, whatever type of patient you may have. Replace any soiled linens and ensure the comfort of the patient. Bottom linens should be wrinkle-free, and the call light should be within easy reach of the patient. For your follow-up care, observe the patient's stool or urine for any abnormalities. Obtain specimen if testing is required. Finally, dispose of the contents of the bedpan into the toilet. Rinse and disinfect the pan and store in accordance with the facility policy.